Welcome to our presentation on nursing professional policy. I'm Sansan Weber, and my teammates are Megan Mueller, Teresa Borelli, Jessica De Jesus, Catrice Miller, and Aidan Lisney. We are going to take you on a journey today, beginning with the birth of the nursing profession and ending with developing a voice and being an advocate in the nursing field. We will start with Megan, who will talk to you about how nursing became a profession, what policies are, and why policies are important.
Hey everyone, it's Megan. I'm here to talk to you about Florence Nightingale and the birth of the nursing profession. Florence was known as the Lady with the Lamp. She was a pioneer of public health and the founder of modern nursing. She improved sanitary conditions through the Crimean War, implementing procedures to increase health. She insisted patients have fresh food, water, air, and laundered linens and bandages. She reduced the death rate in war hospitals by 2/3. She was a reformer and advocated for public health. When she returned from the war, she continued to improve the conditions of hospitals and presented her experiences and data to Queen Victoria and Prince Albert, and helped to form the Royal Commission to improve the health of the British Army in 1857. As a result of her observations, the environment theory of nursing was born. Nightingale explained this theory in her book, Notes on Nursing, What It Is, What It Is Not, which was published in 1859. The model of nursing that developed from Nightingale, who is considered the first nursing theorist, contains elements that have not changed since the establishment of modern nursing profession. Though this theory was pioneering at the time it was created, the principles it applies are timeless. Her book focuses on taking care of the patient's environment in order to reach health goals and cure illness. In 1860, she opened the Nightingale Training School at St. Thomas Hospital in England. This landmark event signaled to the world that nurses required schooling for the work that they did, and provided one of the first opportunities for women to work outside of the home and be self-supportive. Nursing as a profession would not be where it is today without her. What are policies and procedures? A policy is a guiding principle used to set direction in an organization. It is a principle that top executives agree their organization will abide by, and a clear rule that leadership is always prepared to stand behind. A policy is a solid set of instructions and determines present and future decisions. It also aids decision-making under a given set of circumstances. Policies are usually based upon accepted, well-defined norms or standards of practice. The organization's procedures support these rules. A procedure is a series of steps to be followed as a consistent and repetitive approach to accomplish an end result. They explain how the policy is achieved or how it should be carried out. Procedures clarify how to accomplish something in a series of steps that are to be followed in a specific order, providing step-by-step instructions for routine tasks. To give an example, a policy on an indwelling urinary catheter outlines who can perform it, guidelines for when it should be inserted and removed, and how frequently it should be assessed and cared for. Whereas a procedure outlines the equipment needed and the step-by-step process of inserting and caring for and removing the catheter. There are policies and procedures for everything we do as nurses. When we give medications, when we insert an IV or a urinary catheter, or document patient care. Policies and procedures in healthcare are far more than just general guidelines. They set expectations and proper ways of doing things. They guide day-to-day activities, help promote consistency in practices, reduce mistakes, and keep patients and staff safe. Why do we have them? We have policies and procedures to guide patient care and lay the groundwork for a foundation. Policies provide a framework for employees by outlining expected standards for day-to-day operations and help facilities meet the ever-changing health, safety, and legal regulatory requirements in our high-risk industry. Every facility's needs are different based on the type of care that they provide. Therefore, they need to have their own set of policies and procedures. They have to follow laws when implementing and revising policies to receive funding, regulation, and training. For every new law or regulation, new or updated policies must be created and distributed to the staff. They provide uniform information for all employees so that they can do their jobs well and there are no discrepancies. They also promote compliance with regulations, statutes, and accreditation requirements. Why is it important to have policies? Policy in healthcare is vitally important as it sets a general plan of action used to guide desired outcomes and is a fundamental guideline to help make decisions. The purpose of healthcare policy and procedures is to communicate to employees the desired results of the organization and standardize practice across multiple entities within a single health system. They help employees understand their roles and responsibilities within that organization and serve as a resource for staff, particularly new personnel. In the healthcare environment, a policy should set the foundation for the delivery of safe, cost-effective, quality care. Policies and procedures are essential in providing clarity, guidance, and standardization. They improve productivity, efficiency, and protect organizations by minimizing liability. They help to ensure the protection and safety of staff, patients, and the organization as a whole. Written policies can prevent chaos, confusion, and legal issues. The need for these policies is evident when it comes to the impact on healthcare delivery. They enhance patient care and outcomes and improve safety by minimizing harm to patients. Nursing impact on policies and procedures. As nurses, we're expected to identify issues and work with other decision makers to advance healthcare policies. If we as individual nurses see an issue in our institution, we can advocate for our patients by conducting evidence-based research and presenting it to our organization on ways that we can better care for our patients. They will then evaluate it and make a decision. The American Nurses Association efforts are directed at those responsible for creating the modern U.S. healthcare environment, the policymakers and agencies whose decisions will affect patients and those who care for them. They are dedicated to ensuring that the voice of nursing is heard at all levels where these decisions are made. To give an example of what nurses are capable of, take two registered nurses who worked in an OR in New Jersey, Jennifer Pallotta and Joan Bonovic. They read a study that found a large proportion of OR products could be recycled. They used an evidence-based approach, consulted with a medical waste company, and developed a plan that led to significant savings. Another positive outcome of their study showed that a 50% reduction in biohazardous waste that costs on average 10 times more to dispose than other wastes. These nurses advocated for change in their workplace and made a difference. Nurses who influence policy help shape the care that we provide today and tomorrow. So we talked about Florence Nightingale's influence on nursing, what policies and procedures are, why we have them, and why they're important, as well as nurses' impact on policies. Now I'm going to hand it over to Teresa to discuss how policies are developed.
Hi guys, it's Teresa and I'm going to talk about policy development. For looking into policy development, first we're going to look into what shapes a policy. Values. A policy reflects which value or value is given priority in a specific decision. Also with values, you must take into consideration that different people value different things. So with policy choices, it can bring a disadvantage to some while others will gain something from the policy. And having a valid judgment to support or oppose a policy is important. Policy analysis and analysts, here by examining the problem and breaking it down to better understand it, assessing the policy and finding alternatives, and critical thinking plays a key role in policy shaping. By critical thinking, the issues helps identify how groups can act, evaluates alternatives, and determines the policy choice that is most desirable. Politics can play a role in shaping the policy. They can influence policy by indicating there are opportunities to shape the outcome of the process, and also offer resources like financial and human resources. So politics and political action can be viewed as the efforts and strategies used to shape a policy. Next, interest groups. Here they advocate for policies that meet the goal of their members or organizations and can help reach a larger scale of supporters for their goal. Science and research. Scientific findings can play a powerful role in the first step of policy process, getting attention for a particular problem and moving the problem to the policy agenda. Research can also be valuable in defining the size and scope of the problem. And last, the media. They can help get information out to the public and bring light to the issue at hand. Next is the policy process. It can be broken down into 6 steps. First, problem identification. Second, policy analysis. Third, strategy and policy development, followed by policy enactment, implementation, and evaluation. The steps of the policy process can be broken down. First step is identifying the problem. Here you clearly identify the problem or issue you're trying to address. Who does it affect? How often does it occur? And how serious is the issue you're addressing? Next is policy analysis. Research possible options relevant to the problem or issue you have identified. This can be done by reviewing literature on the topic. Also here describing how it impacts the targeted audience and addressing the cost to implement, and comparing costs with benefit can be a big factor. Assessing and prioritizing the options by including evidence that addresses alternatives and opposing points of view on the issue. Third is strategy and policy development. Once a policy solution has been prioritized, the next step is to define a strategy for getting the policy passed and implemented. By identifying how the policy will operate and what steps are needed for policy implementation. Here is where the drafting up of the policy is developed. Step 4 is policy enactment. Here you follow internal or external procedures for getting the policy endorsed or passed, looking at laws and regulations that need to be followed. Next, implementation. Getting the policy into action and monitoring the progress and ensuring full implementation occurs. And last is evaluation, where you assess the impact and outcomes of the policy and use evaluation results to inform the evidence base. The overview of the policy process can be compared to the nursing process, where nurses assess, diagnose, plan, implement, and evaluate. So when you start your new career as a nurse, keep in mind that you can make a change where you notice a change is needed. And knowing that you already know the foundations of policy process from the nursing process, it may help aid you in taking action to make a change, no matter how big or small it may be. Areas where nurses act to influence policies: the workplace, community, associations and interest groups, and the government. In the workplace, nurses work in a variety of settings, like hospitals, clinics, schools, nursing homes, and home health agencies, and many more. Policies guide many activities in the healthcare workplace where nurses are employed, many that affect nursing and patient care, like staffing policies, clinical procedures, and patient care guidelines. For a community, it may be a neighborhood, a city, an online group with a common interest, and even a faith-based network. Nurses can be influential in communities by identifying problems, strategizing with others, mobilizing support, and advocating for change. Nurses can serve in elective or voluntary positions that influence the policy, such as parent-teacher associations, planning boards, and local organizations. With associations and interest groups, many professional nursing associations have legislative or policy committees that advocate for policies that support their members' practice. Working with a group increases the chances for advocacy to be effective, provides an environment where resources can be shared, and enhances networking and learning. For example, the American Nursing Association. Also, for interest groups, some can have a broad area of policy interest, while others focus on one disease, like breast cancer. And the government. This can be any level, from local, state, or federal. Government actions and policy affect us from birth until death. Though most healthcare in the United States is provided in private sector, much is paid for and regulated by the government. So how the government crafts health policies is extremely important. Here, nurses can serve in federal, state, and local agencies. They can serve as electing officers. Also, they can communicate to policymakers their support or oppose a policy, and provide testimony at government hearings and open meetings. How nurses can be effective in policy development. Knowledge and lifelong learning. There's many nursing school programs in different levels that nurses can take to get more educated on policies. Nurses and to help identify problems, research and understand the subject plays a role. Communication is a big factor. Talking to others, getting their points of view, and seeing where their other issues need to be addressed. Volunteering and getting involved. And last, taking action. When there's an issue you see or problem and you think you have a way of solving it, speak up and talk to people to see how you can get a policy developed.
Now that we described what policies are and how they are developed, Jess is going to present on policies surrounding continuing education requirements necessary to keep our licenses once we get them.
So, most states require to complete some form of continuing education every 2 to 3 years in order to maintain their licensure. Not all states require continuing education. About 12 states don't require it, but it could be required by employers or nursing associations. Some states only have a one and done requirement. So when you graduate, you do 10 hours and that's it. Continuing education is also common in specialty certifications. Hours required for specialty certifications and state are separate. For example, your state might require 20 hours of education, plus your certification might require 10 hours. In total, you would need 30 hours of education. They don't overlap. Some states require specific topics to be addressed within your continuing education. Besides that, it's your choice. Doing extra hours of continuing education does not carry over to the next renewal period. It resets every 2 to 3 years, depending on your state's renewal period length. For Pennsylvania, the RN requirements are 30 contact hours every 2 years. There's also a mandatory child abuse requirement, training on child abuse recognition and reporting. For initial license, 3 hours of the child abuse requirement is required. For renewal, 2 hours are required. And the provider of the education training will submit the results to the Pennsylvania State Board of Nursing. So I just want to talk about continuing education units for a second. Continuing education units are also known as continuing education credits, and they reflect the time spent participating in educational activities. One continuing education unit is equivalent to 10 hours of activities. So acceptable continuing nursing education, according to the Pennsylvania State Board of Nursing, acceptable continuing education must be relevant to patient care or professional nursing in a general or specialty area and enhance the knowledge and application of the physical, social, biological, and behavioral sciences. Acceptable types of continuing nursing education are board-certified programs and activities. Skills activities, for example, advanced life support is a common one. There are seminars, professional development events, and academic courses. Zoning into academic courses, courses must be related to nursing. One trimester unit is equivalent to 12 continuing education hours. One quarter unit is equivalent to 10 continuing education hours, and one semester unit is equivalent to 15 continuing education hours. These continuing education hours are the same regardless of the degree program, bachelor's, master's, doctorate, etc. Requesting approval of an activity that is not board certified is possible. The request needs to be submitted to the Pennsylvania State Board of Nursing with a fee at least 90 days prior to the course, so that way they have time to review it. The fee is $115 per continuing education hour requested. So if you have a course that you're interested in and it's not board certified, you can apply for it, but if the course is, let's say 3 hours, that would be $115 times 3. And you want to make sure you do that prior to the course beginning. So fulfilling continuing education requirements, remember, it can be fun. It's good to space it out though. Courses are offered in person or online. There are board certified seminars and professional events, which is a great way to network and scope out employment opportunities. There are some continuing education providers that even offer their seminars in the form of cruises or tropical getaways, which sounds awesome. Nurse.org recommends to choose your continuing education hours carefully so that you can get the most out of the experience, whether it's networking with fellow RNs at a conference or learning a new skill that can be directly applied in your day-to-day job. So paying for these continuing education courses, first you should ask your employer or union because some offer free continuing education to their employees or members. Also, for additional free education, check out nursingce.com. Currently, they're offering COVID-19 continuing education course for free, but they also have a lot more on there. You can also find a lot of courses that are under $50. Some providers offer flat fees, so you pay a certain amount, you get as many hours of continuing education as you want for a certain period of time. There are even scholarships available for continuing education courses. Also, I wanted to mention courses can be written off as a tax deduction when filing taxes. So, records of continuing education hours. Keep all records of continuing education courses, including certificates, receipts, online notifications, etc. The Pennsylvania State Board of Nursing recommends keeping records for 5 years in case credentials are audited. Some employers offer electronic databases to log continuing education hours as well.
We will all soon be earning our nursing license, and now you know the continuing education requirements needed to keep this license. Another area of focus for us newly graduating nurses is entering the workforce. Catrice is now going to present on how policies will impact us in the workplace.
Hello, my name is Catrice Miller, and today I'm going to describe a few of the various effects that policies have upon healthcare delivery in acute and community-based settings. So, what do we mean by healthcare delivery? To put it plainly, healthcare delivery is the provision of treatment to promote well-being. This basic definition encompasses both the action of providing the care to the patient as well as facilitating access to the care. Healthcare delivery can occur in many places, but as stated previously, today I will focus on acute care and community-based settings. Healthcare delivery in acute care settings focuses on the evaluation and management of the individual patient. The main goal is to provide a diagnosis and to treat it. Acute care generally operates on a medical care pattern of disease-specific treatment. This treatment typically occurs primarily in hospitals, emergency rooms, urgent care facilities, doctor's offices, and surgical centers. Conversely, community-based healthcare delivery focuses on the health of its entire population. Strategies are concerned with disease prevention and health promotion. Interventions in community-based settings tend to place emphasis on educating the residents of the community while adhering to regulatory policy. The settings for community-based healthcare delivery can be anywhere within the community, including but not limited to schools, workplace environments, community health fairs, and community health centers. Healthcare delivery policies in acute care and community-based settings are similar in that they both follow federal and state laws. The policies differ in focus. While acute care policies are generally standardized, community-based care policies can vary from organization to organization. In acute care policies, they are set to create a general plan of action used to guide desired outcomes and is a fundamental guideline to help make decisions. Community-based policies create initiatives that are directed to address community health disparities and aid in changing the determinants of health. The important factor to consider is that acute care settings most often provide treatment after the disease is present. The aim of community health settings is to affect the patient at the primary level of prevention to avoid development of disease before it occurs. Regulations that influence healthcare delivery policies. There are many regulations that can influence healthcare delivery. I decided to focus on 4 of the more common, yet very important regulations that influence healthcare delivery today. First off, I'll talk about the Health Insurance Portability and Accountability Act of 1996, or HIPAA. HIPAA establishes boundaries on the use and release of health records. It also outlines safeguards to protect patients' information and establishes civil and criminal penalties for violations. HIPAA applies to verbal, written, and electronic patient records. Now that I've spoken about HIPAA, we move on to high tech. The High Tech Act was born of the need for protection with regard to electronic health records. Advances in technology with the increasing use of electronic health records led to the creation of the High Tech Act. It mandates audits of healthcare providers to determine whether they follow HIPAA privacy rules related to privacy and security rules. The High Tech Act has been called the teeth and claws of HIPAA. Because health records, unlike credit cards, can't be canceled, changed, or reset if there's a breach, healthcare providers have increasingly become targets of hackers. Next, we are going to speak about the regulation regarding the Medicare Access and Children's Health Insurance Program, or MACRA, of 2015. It's another important regulatory factor of healthcare delivery because it directly affects the patient's ability to access care. Unfortunately, the inability to pay can keep patients from seeking care when they really need it. The MACRA Act ensures that providers are paid using a value-based algorithm. And last but certainly not least is medical necessity. Medical necessity is one of the most important parts of healthcare delivery. As nurses, we live by the unwritten rule that if it isn't documented, it didn't happen. The same rings true for the rules of medical necessity in a sense. Essentially, it means that if the procedure is not medically necessary, it will not be paid for by insurance companies. All of these regulations can influence policy development and implementation in both acute care and community-based settings. It is one of the professional nurses' many responsibilities to adhere to and abide by these regulations when providing care. The professional nurse's role in healthcare delivery is multifaceted throughout all of the responsibilities required, but competent communication is a key skill. The nurse must communicate with all members of the care team while focusing on providing the best patient care possible. This communication must adhere to the standards set forth by the policies in place according to the setting, whether acute care or community-based. Lillian Wald, a nurse and human rights activist that is known as the founder of American Community Health Nursing, said, "Human interest and passion for human progress break down barriers centuries old." It is a warming thought that her words still ring true today.
Catrice described an overview of generally how policies will affect us in the workplace. Aidan is now going to do a deeper dive and present a specific policy you might encounter during your work.
Hi, my name is Aidan Lisney, and today I'm going to be talking to you about policy and policy change in the context of substance abuse. For most of our presentation, we've spoken to you about policy from a broader perspective. For my portion of the presentation, I want to zoom in on one issue that's affecting our nursing care and healthcare at large, and show how that affects policy, our attitudes, and our actions. I was inspired by a statement issued by the Joint Commission that said, "When viewed and treated as a chronic medical illness, treatment outcomes for substance abuse disorders are comparable to those of other diseases, such as asthma, diabetes, and hypertension, and can result in lasting benefits." This is exciting to me because it illustrates the trajectory of substance abuse policy in healthcare, even though we have a long way to go. I would also like to add a disclaimer that some of the views that I will be talking about in here don't necessarily reflect my own views on policy change. I'm just presenting the issues as they are. I have two objectives for my portion of the presentation. One is an overarching objective, and that's simply to inspire you to get involved with policymaking, whether it's on a national level or whether it's on an institutional level, which might be a little bit more realistic. My second objective is for you to be able to describe the difference between disciplinary policy and alternative to discipline policy, which I'll speak of later. My goal is not to educate you on addiction per se, but rather to discuss policy that formed around substance abuse in healthcare. Even as such, I'm going to give you a definition of addiction. The American Society of Addiction Medicine has defined addiction as a primary chronic disease of brain reward, motivation, memory, and related circuitry that leads to characteristic biological, psychological, social, and spiritual manifestations. Who is affected by addiction? The short answer is that everybody is affected by addiction. 21% of Americans have at least one addiction, and 10% of them actually receive treatment for it. 30 Americans die every day in alcohol-related car accidents. 130 Americans die every day from an opioid overdose. And 20 to 30% of people who take prescription opioids misuse them. These are pretty random statistics, but I'm just showing them to illustrate how far-reaching and how destructive substance abuse is. Our nation started to outlaw drugs sometime in the 1870s with anti-opium laws. That progressed to the 1900s, where anti-cocaine laws were introduced, and the 1910s and 20s, where anti-marijuana laws were introduced. In 1971, President Nixon declared the war on drugs, and in the 1980s, Nancy Reagan heralded the campaign Just Say No, and DARE came along. There were all these different programs which promoted a zero-tolerance look at drugs and incarcerated people instead of helping them. This negative attitude spilled out into healthcare, and as a result, we battle with these negative attitudes today. Studies show that doctors and nurses have negative attitudes towards people that are addicted to drugs and people they perceive are seeking drugs. However, the tide is starting to change, and it's starting to match how we're viewing other chronic long-term illnesses. This change is moving from punitive to therapeutic. It's becoming more based on compassion and evidence. We're now starting to treat addiction as a disease and not like a moral issue. You can see this in how we are now using medication-assisted treatments like Suboxone and Narcan. How does this sound to you? Does punishment or compassion sound closer to the methodology that we learn in nursing school? Do we extend the same courtesy and offer the same compassion that we do to the overweight patient with type 2 diabetes as the patient we have that is addicted to crack cocaine? We are now seeing the advent of harm reduction services and policy, which aim at keeping those that are addicted to drugs and alcohol safe, rather than inflicting some kind of punitive measure upon them for their addictions. This policy offers a variety of different services. One of these services is offering clean needles to those that are addicted to IV drugs. Another service is administering drug testing kits so that those that are going to be taking street drugs know that the drug that they purchased is the drug that they're intending on taking. Providers are now educating patients on basic phlebotomy, sexual health, and wound care. There's also better access to Narcan and other medication-assisted treatments such as Suboxone, arguably the best aspect of harm reduction policy. There are now sites called supervised injection sites, which are pretty controversial. These locations allow the IV drug user to go under the direct supervision of a healthcare provider, who administers the drug for them and is able to continually assess them so that they're kept safe while under the influence. We now have Good Samaritan laws being put into place that incentivize people to take their companions to the emergency department if they're overdosing without the fear of retribution or getting in trouble by the law. How do these services benefit us? Well, a third of IV drug users aged 18 to 30 have hepatitis C. There are many ways that we could view this, but I'll present two. We could view it from a compassionate perspective, where we're seeing a large population of people that are vulnerable and contracting a terrible disease and desire their recovery for them. The other way we can view this is from a safety perspective. We're coming into contact with these patients that have hepatitis C and have contracted it through means that are modifiable. If we can educate this population or provide them access to clean needles, we might be able to reduce the amount of people that are contracting these diseases and in the end prevent certain healthcare providers from contracting those diseases as well. It's shown that these harm reduction services reduce the amount of drug-related deaths. I think as healthcare providers with patient-centered care as our prerogative, this fact should really speak to us. These services also help develop a trust between healthcare providers and addicts, and it opens a doorway of communication between us. Historically, we know that communication hasn't been very good, but by developing these judgment-free attitudes and actions, we might one day open the door for somebody to come to us with their own problems, somebody that we didn't even know was struggling, such as a coworker or a family member or a friend. Perhaps we could help facilitate the recovery by this mentality adoption. Lastly, these services sharpen our skills as healthcare providers. As nurses, we embrace education wholeheartedly, and we should be jumping at the opportunity to have new education moments with our patients. This also gives us an opportunity to be a better advocate for our patients, as we now have new services that we can discuss with them and provide for them. Let's talk about substance abuse in healthcare. It's estimated that 1 in 10 nurses abuse drugs or alcohol, and it could be anywhere of 14 to 20% of RNs have an actual developed addiction. 1 in 10 physicians will abuse drugs or alcohol at some point in their lives. What is the mechanism behind this? There's not one specific risk factor involved with addiction, but for healthcare providers, it seems to be related to the long shifts that they work, the stressful work environment they're in, and having access to drugs like fentanyl and morphine. It's also easy to divert these medications. There's a lot of waste with opioids, and it's easy to take that waste without anyone noticing. Healthcare providers also have an advanced knowledge of these medications and know how to abuse them. But how does this affect us as nurses if we ourselves don't directly battle with an addiction? Why should we care? Well, this answer really comes back to us at some point in our careers. These are our patients. These are our coworkers. They're our family, and they're our friends. And we don't know, one day this could be you, it could be me. It would benefit us to be concerned about substance abuse in healthcare because this illness is shaping our policy and it's forming our work environment, whether perceptibly or imperceptibly. Let's talk about disciplinary policy versus alternative to discipline policy. Many healthcare institutions have in place punitive or disciplinary actions that they take against healthcare providers that are caught under the influence of drugs and alcohol or diverting medications on the floor. Some of these are zero tolerance policies, where the first time that this would happen, the provider would be immediately terminated. For a nurse caught under the influence, due process could be taken against them involving the State Board of Nursing. Their license would then be suspended or it could be revoked. They would then be fired from the institution and would no longer have health insurance. The consequences would be even more severe if they were caught diverting medications. Legal action could be taken against them. They could be incarcerated and then incur a criminal record, and this would effectively destroy their career in healthcare. What I really like about the Joint Commission statement that I read earlier was that it pointed out the illogic of these punitive and disciplinary policies. If we as nurses provide compassionate, evidence-based care for our patients, why are we not having the same thing given back to us? From that type of mentality evolved alternative to discipline policy, which aren't, despite the way the names sound, lax in their treatment of the provider who's caught under the influence. However, these treatments are evidence-based and they are compassionate at their core. Under an alternative to discipline policy, if a healthcare provider, such as a nurse, was reported to be under the influence on the floor, their supervisor would have an intervention for them, in which they would present the alternative to disciplinary policy to them and offer them the ability to attend a rehabilitation program. This would be done in conjunction with the State Board of Nursing as well, and through a third party like PNAP, which is an excellent program that nurses can go to that struggle with substance abuse disorder. Throughout this process, there would be periodic drug screenings, probably an initial psych evaluation, and mandated program attendance to Narcotics Anonymous or Alcoholics Anonymous. They would then have a return to work agreement in place where the nurse would only have a limited amount of hours that they could work. They wouldn't have access to narcotics, and they wouldn't be able to work on certain shifts like night shift, where it might be easier to obtain those drugs. This continual monitoring and assessment process would last for 3 to 5 years. Now, these policies aren't done everywhere, and it varies from state to state. However, they do allow nurses to get help by keeping their insurance plan, and they promote recovery. In the end, policy is important because it's a reflection of us as nurses on a macroscopic level. These are the thoughts, attitudes, and actions that are directly linked to our nursing care. So, does the idea of changing policy bother you in regards to substance abuse? How do you personally feel about clean needle administration or safe injection sites? Perhaps you like aspects of these changes, like incorporating evidence-based practice and compassion into your care, but you think that some aspects are immoral. How do you feel about alternative to discipline policy? If these changes evoke a negative feeling inside of you, I think that that's good. I think that this is something that can move you towards action. If you feel positively about these changes, I think that's great too. Your feelings toward these changes should push you towards being a part of the solution. There are many ways that we can do this in regards to substance abuse. There's the Pennsylvania Nurse Peer Assistance Program, which I spoke to you about earlier. It's a monitoring and advocacy program that's approved by the Pennsylvania State Board of Nursing. They're dedicated to helping us nurses and nursing students deal with substance abuse disorders, mental health disorders, and any disorder that might affect our ability to practice. If you wanted to become involved with change on a national level, you could join the National Council of State Boards of Nursing, which is an organization dedicated to providing safe nursing care for the public, and they're also dedicated to advancing the profession of nursing in general. However, these are just two options that we have as nurses to take to improve policy and to participate in policy change. Ultimately, I hope to see us get interested and involved in small ways, so that way we can take more responsibility in the care that we're providing for our patients, and we can feel a little bit happier about the environment that we work in. Thank you.
Hi, this is Sansan. Now that we have talked about what policies are, how they are developed, and how they can impact us as nurses, I am going to talk about policy changes and the role of leadership and advocacy. Healthcare reform is always a hot topic, especially during election time. But healthcare is a constantly changing arena. There are a couple of factors for this, mainly due to costs, but also because there is an abundance of needs and there are identified gaps in care. Being able to identify these gaps and bring them to the forefront supports the spirit of inquiry, which is an NLN competency. Policies have to change with the times. To keep up, modifications to existing policies need to occur, or development of new policies is crucial. Changing with the times is something I call landscape changes. An example of a landscape change is a policy Catrice mentioned earlier, HIPAA. Prior to HIPAA, there was a lot of information sharing and policies were not strong enough to adequately maintain patients' rights to privacy and confidentiality. For example, prior to HIPAA, everyone knew that Aerosmith was at the Cairn Foundation. They knew when they got there, what they were doing there, and how long they were there. After HIPAA was developed, every agency needed to strengthen any existing policy they had or develop new ones to address patient privacy and confidentiality. Another reason policies have to change is with technological advancements. An example of this is electronic health records, or electronic medical records. Once upon a time, it was all paper charting. Once the technology was developed for an electronic health record, all agencies needed to develop new policies to address this new technological advancement. Change is necessary, but adapting to change makes or breaks you. To help you navigate these changes, you need a strong leadership team. Leadership is a process by which a set of skills and attributes are used to affect change at all levels to attain a common goal that advances healthcare. Leadership influence is important in advancing health reform. This semester, we learned about formal leaders, like members of your management team, who will develop and implement any new policies that address changes in federal or state regulations. But we also have informal leaders, such as your direct care staff, who will also help in policy change by getting buy-in from others. Developing leadership competencies in your direct care nurses will result in advancing priority advocacy needs at all levels, attaining equitable healthcare services, and improving population health. Leadership skills do not come naturally for many. They need to be developed. We know the importance of evidence-based models as they are research-based and have proven positive outcomes. One evidence-based leadership development model is the Kouzes and Posner model, which has 5 main components. Modeling the way is very similar to this quote by Mahatma Gandhi, "Be the change you want to see in the world." It's not about talking the talk, it's about walking the walk. So for example, if you say that nursing is a caring and compassionate field, then you will treat your clients, patients, staff, and students with the same care and compassion. Inspiring a shared vision. Many of us have differing views and opinions, but when we work for an organization, it's important to have a common goal, a shared vision. Many agencies have a mission statement which serves as their shared vision. Challenging the process. Quality of improvement is continuous and constantly assessing and evaluating our processes to determine if they result in the best care for our clients is important. Cultivating this type of questioning or spirit of inquiry in our leadership is also important. Encouraging the heart. Many people going into nursing are passionate about caring for others. Leaders encourage this passion and allow passion to be the voice. Enabling others to act. Some leaders want people to just fall in line and do as they are told. Good leaders validate people's contributions, support their voice, and encourage them to get involved. As I said, leadership skills need to be developed, and using an evidence program is critical in establishing a strong foundation of advocacy skills in direct care nurses. So what is advocacy? There are many definitions of advocacy out there, but the one I like states nurses' actions of arguing positively on behalf of patients, families, or populations to persuade others of needed change that contribute to health and healthcare improvements. This requires some nursing judgment, which is an NLN competency. When I say it requires some nursing judgment, I mean that you have to be able to identify the issue, support your issue with data and evidence, know the right person to bring your issue to, and also know the right time to do that. This requires some nursing judgment. Advocacy in policy and politics is the mechanism by which change occurs in healthcare systems at both the micro and macro levels. And advocacy is not only about advocating for patient care, but it's also about advocating for yourself and your peers in things like staffing ratios and also the nursing profession as a whole. It lends itself to the spirit of human flourishing, which is an NLN competency. Why should nurses be on the forefront of healthcare reform and advocacy? Well, nurses are natural advocates. Advocacy and policy are not new to the nursing profession. From Florence Nightingale's formative Notes on Nursing, What It Is and What It Is Not, to the Institute of Medicine's 2011 report, The Future of Nursing, Leading Change, Advancing Health. Both of these reports focus on nurses as a critical player in advancing healthcare as they are on the front lines and have knowledge of what works and what doesn't. They can identify care gaps and can improve the workforce data collection and analysis process, which can lead to improving policies and procedures. Also, nurses are sometimes frustrated by regulations or policies directing nursing practice, especially when they're generated by those with little knowledge of healthcare. Many of the policymakers on Capitol Hill have little or no healthcare experience, which can be frustrating. So a number of nurses have used this frustration to fuel productive changes and become nurse advocates. They've taken on this new role to influence and change the policies, laws, and regulations that dictate our practice and how the larger healthcare system works. So now that you're super excited about advocacy work, where do you begin? Here are a couple steps. First, find an advocacy mentor. There are people who do advocacy work on a full-time basis and would love to share their passion and skills with you. 2, enhance your advocacy skills. Keeping up to date with changes in the world and within our field is important. Many times when you're watching the news, you might think that what's happening does not have anything to do with you, but many times it will affect healthcare policies in some way or another. Read journal articles and be aware of the latest research. Staying up to date on evidence-based practices in your field will be very helpful. 3, joining professional nursing organizations which can enhance development of your professional identity, which is an NLN competency. Many agencies have a healthcare policy and advocacy committee that you can join, and some of you have already started in advocacy by being part of our Student Nursing Association. You just heard me talk about how policy changes are necessary and important, but all essential workers will appreciate this slide as many policy changes came fast and furious in the last, it's been 6 weeks now, and our hair looks like it's on fire. Now that you know some information on this topic of nursing professional policy, tell us what you think. How do you feel about nurses who have a history of substance use issues being allowed to work with medications in general? How do you envision yourself being an advocate in the nursing profession? What types of activities would you be involved in? And do you envision the current coronavirus pandemic affecting change in current policies? If so, how? I know one group is doing telehealth, and so maybe think about changes in that area. All of our presentations focused on the importance of the nurse's role in advancing healthcare policies, policy development, and changing policies. I want to leave you with a quote by Loretta Ford. Loretta Ford is an internationally renowned nurse educator. In the 1960s, she identified a gap in care related to the shortage of primary care physicians. She was at the forefront of the nurse practitioner movement to train nurses to be advanced practitioners to help bridge that gap in care. She says, "Get to the table and be a player, or someone who does not understand nursing will do that for you." I hope our presentation motivated you to take some action, as we are the change makers of the future. Quarantine, Class of 2020. Thank you.